So what exactly is this thing called gum disease and how does it affect your teeth? Hi everyone, my name is Dr. Darrell Ong. So today I'm going to be talking to you guys about periodontal disease, or specifically periodontitis. Now, a typical example of somebody with really bad gum disease is something like that, where you observe lots of plaque, lots of tartar all around the teeth, and you see there are areas of inflammation and redness around the gums. Now, to understand the problem of the disease, we first have to look at what is the anatomy. So, we start off with the cross-section of a tooth, right? So, the top part is what we call the crown. It's what, whenever you and I smile, is what we see. Now, under the gums, you have the bone structure that is supporting the tooth, as well as the root area, or what we call the dentine area. Okay. Now, specifically, what we want to focus on is the gum area around the tooth. Now, over here, there's a little bit of a space. Okay, so everybody's like that. Now, when we measure the space, it's usually about 1 to 3 millimeters in depth. Now, what happens when you do not brush your tooth, or not being very particular about your oral health, and you allow bacteria to accumulate around this area? So what happens then? The body tries to fight this bacteria. So the body sends all your red blood cells and white blood cells, everybody over here, to fight off all these bad guys. So what happens is your gums become red and inflamed. And the typical presentation or typical complaint is that when you brush your teeth, they say, hey, my gums actually bleed. Right? So that's an early sign of gum disease, or what we more commonly know as gingivitis. What happens when we allow this bacteria to stay there and allow the inflammation to persist? Now you start to lose a little bit of bone around this region. If the disease is allowed to stay even further, God forbid, all right, now you get something what we know as severe periodontitis. And most of the time the patients come in saying, my tooth is shaky. Why? Because the supporting bone has already been destroyed. Thank you very much for your attention.